And here she is, just like that. Hi, Sharina.
Good evening, Francesca. Good evening, everyone. How are you? Welcome in.
We are great.
This is a first, isn't it, Francesca?
This really is, and goodness me, you look like you've done this before. This is very slick, and what an
Uh,
introduction to your clinic. I'm very
thank
excited to
you.
see it all. Maybe you
Thank
can
you
talk
so
us
much.
through where we are.
Absolutely. Well, we've just come through our front door and we're very nicely tucked away in the heart of Beaconsfield Old Town. We are super discreet because we want to be immersed in our own world of aesthetic science, and we also want our patients to be immersed in their own very private, very discreet world of their aesthetic treatments. So yes, we're nicely tucked away. So I call this my hidden den.
It's definitely a hidden den, and there's some exciting stuff going on there. But Sharina, thanks so much for being here with us tonight. I was just explaining that
Pleasure.
this is going to be a bit of a first immersive spirit experience for us at
Right.
TBT. But I'm excited to be doing this with you and to really be talking to you about total reset, which is what I think a lot of us are thinking about as we start 2021, you know, how to switch up our skin, our hair and our sort of bodies. And I know you're the woman who has all the answers.
Well, I have everything. I hope I have all the answers. We always say we have everything in here for everybody, and it's just a matter of really listening to our patients, really understanding what they are searching for, what they need, what they want, and
Yeah.
then kind of bridging that and putting it together and delivering and
Yeah.
getting them the
And you
result.
and you do it brilliantly. Whenever I've been to visit you, I've always left with a real spring in my step. We're talking about total reset, so maybe it's a nice time just to for you to jump in and tell us a little bit about what resetting means to you.
Sure, absolutely, Francesca. And first and foremost, I would love to say thank you. Thank you so much for inviting me to be a part of this, especially for the start of 2021. And what better topic and one that's very close to my heart, especially right now. It's been, as I'm sure you'll agree, and I'm sure all of you out there will agree, it's been quite an interesting 10 to 12 months. We started 2020 not knowing what to expect, and boom, a lot has changed, for each
Absolutely.
and every one of us in the world. And a lot has changed from also the way in which we approach our patients and deliver treatments. Now, when I think about the reset, I'm going to have to bridge it into two compartments. And I'm going to base it on my patients because, first and foremost, that's what I practice and believe in. There is a group of patients who spent a lot of last year, when that first bit of the lockdown happened, really taking that time to say, what do I need? What do I need to get through this? What do I need to focus my attention on? What do I need to get by? And they
Yeah.
focus on themselves first and foremost. And that's what we always try and practice and believe in. And for those patients, they have gone through 2020 and they've actually emerged into this side, setting the goals, expectations, and the treatments that they have worked with us. They've actually come into 2021 in a much more positive skin health and body mind. So much so, we're able to take their results that we've championed over the last 9 months, and we're actually throwing them into 2021 with better, more advanced treatments.
That's
That,
amazing.
so that is one bit of reset. So we're now resetting, getting them to where we are, and then we're good to go. But hey, guess what? We've shut down again. So we've not even started 2021, right? Um,
I know, and I think what you were saying about sort of starting on the right foot is just such a positive message right now. I think you're right. The last 12 months were very turbulent, and I'm never going to use the word unprecedented because I think it's been thrown around so much. But I do think that we need to continue looking forward and make plans for when we can next get into the clinic and set those goals for ourselves.
that's right.
And tell us a little bit about your patient journey. So you've invited us, you know, beautifully into your reception area. It looks gorgeous in there. Where would I go as a new patient? What would I see next?
So back in the old days, as a new patient, you would have checked in with my reception team over here,
Mhm.
and you would have come on through into our waiting room, and you would have had a nice seat, and my team would have welcomed you and offered you some water. And I think that experience and that welcome and meet and greet is super, super important because patients can come and they could feel potentially very nervous. They might have been thinking about having an aesthetic treatment anywhere from 1 day to 1 week to 1 year to even 10 years. So we want to be very mindful, very respectful, very appreciative of that situation and ensure that we give them the introduction that they dutifully deserve. Everything's changed right now, so I'm going to tell you where the introduction to our patient journey
And this is
starts
your
from
room, which is
right now.
gorgeous.
And it starts right here. It actually starts with that very button right there.
Yeah.
Zoom. Telemedicine. Telemedicine is something we adopted back in March last year when we went into the first lockdown. And I have to say, we've not looked back since.
We can't. Virtual is so important now, isn't it? It's how we're staying in touch. I mean, look at what we're doing right now.
Absolutely. It's such a, how fortunate are we to be able to do this? 2 years ago, 5 years ago, I don't think we would have been able to do that. Whereas right now, over the last 10 months, my team and I would agree, our patients would agree that this is the best way of doing it. It gives patients the access to be able to do this safely from the comfort of their own home.
Yeah.
And I think right now we have to be really sure that we practice safe medicine, especially with everything that's going on right now.
I agree.
They're at home. They get to actually see myself, you know, with absolutely no mask on. Otherwise, when they do come here, we will be fully masked and we'll be PPE'd, as you know. And I get to see them as well, all natural, barefaced, no makeup, comfortable, you know, in private in their home. And there's a lot to be said about the quality of the lenses right now. We can see skin, we can see facial redness, pigmentation, we can see contours, we can assess our patients very effectively. And so by that time, we can also create a bespoke treatment plan, give them a really good idea of the treatment options, direct them to the information sources that they need to make those informed choices. And first and foremost, I also want to mention the cooling off period. In the old days, we used to practice a cooling off period following a consultation where a patient would be allowed to have 2 weeks off to make those informed decisions. Now the patient's at home, so they can take the time they need.
It's so true. It's been such a valuable sort of moment to pause for the patient, hasn't it? And I think you're so right. Everything that you're doing, even though it is virtual, it's still really underlying the importance of that initial consultation, because that's where the big decisions are made, aren't they?
Absolutely. It's all down to great consultation. And I advise anybody out there, whoever you may see, whether it's for skin, face, body, anything, it's all down to a fantastic consultation, that connection with your practitioner, their entire team. Because this is not going to be a one-stop shop. This isn't going to be something that you're going to, you know, achieve in 6 weeks. It might be, but what I'm really looking for now is something long-term results, long-term goals.
Yeah, agreed. I mean, it's great, and I've been to your clinic, so I can vouch for this. But you use technology at every level, and I know we're going to find this as we walk through the clinic. But I suppose, how are you using it to empower patients at the start of this journey that you take them on?
Sure. Well, come on then. Let me take you through the next part of my journey. We've got lots of feel-good things from Christmas to keep us going, just to let you know. So,
oh, cute.
You might find little nice things around the clinic dotted around, but this is my power suite. This is my tech suite.
Wow, look at it in here.
Okay, welcome to my imaging suite.
This is super cool. I love all the gadgets. You need to explain everything. Yep, so I can see is that the Visier straight in front of me?
Absolutely. So this is one of the first pieces of technology I actually invested in when I opened the clinic 5.5 years ago, Francesca, because I come from a world of plastic and reconstructive surgery, and you know, it's all about restoring form and function.
Yeah.
I don't practice any reconstructive plastic surgery anymore, but for me, it's equally as important to restore form and function within the skin and within the body and everything that I do. So I want to be able to measure my own results to make sure I'm doing a good job as a practitioner. So I love good clinical photography, always have done, and I love personal photography as well. So in order to do that, I wanted to be able to educate the patients as well, to make sure that we can track their results, we can see and measure their results. And fundamentally now what we want to be able to do is predict their results. So when we see new patients, we can say, hey, this is how you should be able to get here with our treatment plan approach. And we should be able to guide you, measure results, and to enable you to see that you're going to be guaranteed that if you follow the right track. So
it's clever as well, because you're empowering the patient in enabling them to go on that journey with you, and also to understand the effects of the treatments that you're going to do. I think it's great to have tangible evidence of that transformation that's going on with you.
Absolutely. It's not about me, it's not about us, it's about the patient. You know, they come to us wanting intervention to get to a certain goal, to get to multiple goals, and we're the middle girls. You know, we're here to actually deliver what they're requesting. So it's great to be able to educate the patient. And I feel when a patient really understands their own aging process and what has gotten them to the present based on their past medical history, their social history, their drug history, their lifestyle, the way that they live their lives, they will be able to then understand what it is that's brought them to this point, so we can reset, reflect, reassess, reevaluate and re-strategize a
Yeah.
treatment to get them in the next direction. So this is Visia, and I think you might have had one of these, Francesca.
I think I've had a few Visias in my time. I think it's always a bit terrifying to see the results that come out, but it's all good, and knowledge is power, and
Knowledge is power.
we like to be armed with that knowledge.
So I use Visia every single day. I have an objective, no treatment, no Visia, no treatment, because the patient needs to be educated. Visia takes a 3D image of the skin, and it looks at the external profile as well as 2 millimeters underneath. So it takes a straight flash, cross-polarized, and it can look at things like this. 8 key areas of concern: your lines, your wrinkles, your texture, your pores, superficial and deep pigment, and something called red areas. And I really focus on something called inflammation. I talk about that a lot.
Yeah, super key right now. You know, everything's leading to inflammation in our skin and bodies, isn't it? And I think what's great about Visio is it's really allowing you to sort of peer beneath the surface of the skin and understand what's going on at a much deeper cellular level, and the changes that are going to occur sort of long term.
Absolutely, and it all begins from the cells. And I'll talk you through why I really enjoy cellular changes.
Yeah.
But, you know, for example, this is somebody who came in, and I just want to say all our patients who have shown those photos, they've consented to those photos being shown. This is on the 8th of July last year when we first came out of lockdown. Beautiful young girl, and you can see a bit of facial redness, pigmentation, puffiness, some textural change around the skin, some pores. And what we can see here is some melasma. She came wanting laser treatments at that time. Now, you and I both know we're unable to do laser treatments in someone who's actually sun-kissed, sun-tanned, and we actually have to prepare the patient. So this is her in December, all prepared, all skin treated, and ready to go on to Picosure. And it's great to be able to show these patients the influences of pigmentation reduction, redness reduction. I'm sure you can see that.
That's a phenomenal result. Look at that.
Thank you. And this is all with topical formulations, high-tech medical facials, all really customized to the patient. And we can now show her results on a very, very cellular basis.
It's that nice blending of different treatments and protocols that you always talk about that's getting you to that end result, isn't it?
Absolutely. So with that in mind, we then, you know, furthered on to the hair metrics. Now, for me, skin health doesn't stop at the skin. It actually also starts at the scalp.
Yeah.
So we introduced something called the hair metrics analysis, which also uses imaging on the scalp. And this is so exciting because this is brand new to the UK. I think there's only 2 hair metric devices here in the UK. And this is a patient who's had the HydraFacial Keravive for the scalp. And I want you to just compare the image on the left to the image on the right. Can you appreciate there's a little bit less inflammation on the image?
Definitely. There looks like there's less redness and everything.
I know. So we hold a lot of tension in the scalp. And when we actually carry out the Keravive treatment, which I'll show you upstairs, we actually get a higher quality scalp health. We get better hair growth. We actually get thicker and more voluminous, shiny hair with more keratin as well.
Amazing. It's going to be great to look at that Keravive upstairs. And now what's this? This is your Vectra machine.
This is my Vectra. So evolving from there, we don't just want to look at the skin. We want to look at the skin, face, body, and literally top to toe.
Yep.
So this enables me to do 3D for the body, as well as to also look at facial contouring as well. I do carry out a lot of facial injectables. And we want to use our imaging to be able to consult, to assess, to predict, to also treatment plan, and then finally just to look at the results here. So a patient can actually identify that they're not going to look too different. They're just going to look stronger, more empowered. Can you see that one there?
Yeah, beautiful bone structure. I mean, she was beautiful to begin with, but what I think that must have done for the patient is really give her confidence in what a treatment could do. And I think, you know, particularly when we're talking about injectable treatment, there can be a fear of the end result. And, you know, will I still look like myself? Will people be able to detect that I've had treatment done? And I think what you can do via these technologies is really empower people to know that they're in safe hands. Okay, absolutely. Sorry, the tour's moving on and I'm still talking.
I'm making sure that my camera's not tilting. This is all brand new for me.
So we're upstairs in a bright pink room. Oh, wow, what's going on over here? This looks great.
As you know, I'm all about tech, so I've switched on all the tech I can possibly have.
Your energy bills must be through the roof. I'm joking.
So thank you, Lydia, for all this wonderful setup and Simon today. But I wanted to focus on my high-tech facials right now, if that's okay, Francesca?
Yeah, definitely. Let's talk about the facials.
So high-tech facial treatments actually start with just resetting the skin, but also waking it up again. And I love to revert to my good old HydraFacial to do that.
Oh, we all love a HydraFacial.
Oh, can't beat a good HydraFacial. Literally 6 facials in one, starting with lymphatic drainage to really, really de-stress and decompress the skin. And I love the way that makes me feel before I have anything, really, to be honest with you. But it's all about that combination. We call them hybrid facials because there's the combination between mechanical exfoliation and chemical exfoliation that comes within the actual treatment itself.
That's the little head that sort of sucks up all the debris on the skin surface, is it?
Absolutely. So it's a mechanical exfoliation, and each and every one of these is glycolic, salicylic, hyaluronic acid to decleanse, exfoliate, purge the skin.
They're completely bespoke in that sense, aren't they? You know, no matter your skin complaint, there's always going to be a protocol to suit your skin type.
Absolutely. So this is a skin treatment for absolutely everybody, and we can make it so bespoke with other treatments to reset the eyes. We see a lot of Zoom eyes at the moment, very tired, very.
Just seeing them on me.
Absolutely. So we have 2 things. We've got perk for the eyes.
Yeah.
So you can actually exfoliate the skin around the eyes very gently because the skin here is much thinner, and that infuses then a beautiful peptide solution that you can take home. So what you actually have is a lot of in-clinic, at-home treatments that patients can benefit.
I think that's exactly what we all need now. I mean, particularly whilst we can't get into clinic, anything we can do at home is great, but also just the supplementary support that we can do ourselves as patients at home to supercharge what you're doing for us in the clinic.
Absolutely, and I think these treatments, they might look so gimmicky or gadgety, and excuse me, HydraFacial, for saying that. I did say that to them, but the evidence that we see with every treatment where patients have it to reset even the skin on their lips, we hold a lot of dead skin on the lips, and you can see the amount of skin that comes off with these type of treatments, because guess what? You know, there's a lot of dead skin that comes off that we show our patients at the end of the treatment.
And what is this dazzling contraption on the bed that's glowing and looks very enticing?
So this is what I call my brand new Celluma. Okay, Celluma is a revolutionary, brand new LED phototherapy device. So I've had LED in my clinic for several years, but I've literally just upgraded my technology over the last 2 months to something that has been FDA cleared since 2013, and we have now the Celluma for the bed, and we now have the Celluma for the face as well. So
oh, brilliant. So you can literally do top to toe like everything else that you're doing.
Absolutely. So the nice thing about Celluma is that it has 9 FDA clearances. It has 3 for aesthetics, and it actually has 6 for pain management. And it's what I call shape-taking. Shape-taking means that you can actually bend it around anything you want. You can bend it around your face. The tighter to your face, the possibly you can get, the better for it. And it has these low-level light therapy pulsing technology. And literally what it is, it's non-thermal, it's non-invasive, and it wakes up the Duracell battery of the skin, which is called the mitochondria. In my opinion, when you asked me earlier what reset means to me, it's not about generally taking a pause in life. Sure, we should take and respect the pause in our lives, but we should also reawaken some of the cells that have gone to sleep. I talk about something called PC posture because we're spending too much time like this.
Cramped and hunched over our computers. Yes, that's me.
Absolutely. So this is great for full body, full family. You can actually use it for, I use it on my dog Spartacus.
I know, you've done the most amazing Instagram posts on Spartacus having his LED therapy. But it's also such a nice thing to be doing at this time of year. And I always think with any sort of light device that you can sort of lie under and conk out for 5, 10, 15 minutes, it's a needed pause in your day, isn't it? And the fact that it's doing something on a cellular level is brilliant also.
Yes, it's phenomenal. Just by having 3 sessions of this, you can even reduce the concentration of P. active bacteria in the skin by up to 99%. You can increase the hydration of your skin by up to 61%. It's very significant. And for me, when I put it on my face, I actually switch off. So I have a device that's on, switching me off, and I'm completely switched off, and I go to sleep.
You're a real techno lover. What other gadgets do you have in this room? What are you showing us now?
This everybody should have in some stage of their life. This is for collagen stimulation. This is radio frequency using my ND-Med.
Oh, I love a bit of radio frequency.
Love a bit of radio frequency. So just where we lose 1% of collagen as we age every single year, we want to wake up that collagen-producing baby cell called the fibroblast. So this is, again, non-invasive, very comfortable, feels like a high-tech hot stone facial, and applying a little bit of gel, we can actually gently reawaken the collagen by heating up the skin to what we call.
It gives a really lovely sculpted effect, I always think, whenever I have radio frequency. Like very, very natural, but the face just looks like it's energized, and all the tiredness has somehow been wiped away.
Absolutely. So we can use it on the face, we can use it on the eyes with the eye fine tip, we can use it also on the body.
So this is your body applicator, the slightly bigger one.
Absolutely. Slightly bigger body applicator to get to a deeper area. So it's what we call the 3D technology, and those generators bypass the top layer of skin very safely, very comfortably.
And what does it feel like on the body? You said it feels a little bit like a hot stone massage on the face. Is it the same on the body?
It feels like paradise. It feels like you're on the beach without the sand, unfortunately. So true. So whilst we're on the topic of body, do you want to see one of my sweet body rooms?
Yes, please. I think we're all dying to see another room. What other toys have you got going on right now? So this is the body suite.
My body suite, yes. And
look at all this fun in here.
True state-of-the-art technologies, very exciting. A laser for fat removal. You've seen my radio frequency for skin tightening, and this is one of my all-time favorite EMSculpt that was coming to the clinic in August 2018. So we're actually coming up to 3 years with EMSculpt. But what I love about it is that it wakes up the muscle again, and it grows muscle. So it's the world's first technology to build muscle and simultaneously burn fat.
And I think that's what all of us are after, isn't it? I mean, we're not just about wanting to get rid of fat now. We actually want to hone stronger, more resilient bodies.
Absolutely. And I think it's about, just waking up again. Reset is not just about putting ourselves to bed and relaxing. That's really important. And I know that. I don't switch off easily. I love what I do what I love. But I think now more than ever, it's also about getting more physical and actually making sure we don't get too sedentary. This lockdown and next lockdown and whatever lockdown I hope doesn't happen.
Agreed.
So, physical activities, and this really works too.
And the EMSculpt is amazing technology as well, because it has a real functional gain, doesn't it? I mean, I hear great case studies of people who have back pain, and it's eliminated by strengthening the core with the EMSculpt. I mean, the equivalent of how many squats and sit-ups it does is frankly quite astonishing.
It's amazing. You can get 20,000 supramaximal contractions in just one 30-minute treatment. So what you can get with a protocol of 4 sessions done over a 2-week period, you can get clinically evidence-based results to build up to 16% muscle bulk. You can actually reduce fat by up to 22%. All of our patients who have had the treatment have reduced a minimum of 4.4 centimeter peripheral circumference. And they all feel amazing, and the posture and the back pain right up there. So much better. And for the women, hard to treat area.
Oh, the triceps. Thank goodness somebody finally invented something to tackle those.
Absolutely. And I'll be honest with you, following doing these, I feel my tricep dips are so much easier and so much more powerful as well. So
I mean, what do you think? That the exercise should be sort of avoided on the days that you're doing these muscle stimulating technologies, or?
There's no real rule, Francesca. I mean, I always say to patients, a lot of my personal trainer patients actually come in after they've done a few sessions of personal training that day. However, I say to patients, look, you're about to get 20,000 on the couch, so why don't you take it easy? But make sure you stretch, make sure you eat well. Don't just depend on the tech to get you a result. Do some work yourself, put some work into it.
Exactly. It's always got to be a two-way street, hasn't it? So you've moved rooms while we're talking again. This is your trick. Where have you taken us now?
I have so many favorite rooms in my own clinic. I've actually made the clinic for myself. My team laugh at me when I say that, but it's true. It's for me to become a patient. Laser is all about safety. I want to say that because it's really important to the audience out there to know when you go for your lasers and your patch test, both your practitioner and yourself need to be really, really safe.
Yeah, goggled up. We don't want any.
Absolutely. But I love my laser tech because when it comes to the reset, we can take away the it's almost like airbrushing the skin, because you're taking away the little red dots that might have come due to vascular dilatation, sometimes rosacea, broken thread veins. Take away little bits of pigment as superficial or as deep as you want to go.
And this is all the stuff that you've detected already downstairs on your Visier, isn't it? You know where the underlying pigmentation and redness is, so you can go straight in there with that laser and zap it.
Absolutely. And, I want to be really precise for our patients. So here we have the world's first melanin reader. It's called SkinTel.
That's super cool. I didn't know you had this.
I know, it's FDA cleared. It took the professors at Harvard many, many years to create something like this. So we can actually measure the concentration in melanin in our skin.
Yeah.
As you and I both know, with the type of world we live in, intermarriaging, we don't really know the classic fat-free classification of skin. So this allows me to be as detailed as I can be.
So how does that work exactly? Are you looking for a sort of excessive amount of melanin in the skin, which would sort of mean that you need to perform some sort of a treatment to balance it, or what would you action from those results?
So for example, when I take an average of 3 melanin counts, I actually Bluetooth it over to my Icon device.
Yeah.
And I get a reading, and I can use that reading to set parameters to treat my patients each and every month. So every single time their melanin count is checked, and I can really refine my settings to make that treatment experience and the treatment results.
I see. So it's enabling you to be even more bespoke with the treatment that you're then delivering to the patient.
Absolutely. So it's all about not even personalization, it's hyper-personalization in this day and age. We've got to be even more accurate, to be even more safe, even more reproducible, even
exactly.
faster. So
and what are these here?
I've got a lot of toys here. So we do a lot of pigment correction with this one, Max G, and this one is something called my 1540. So both my Cynosure devices. So this is what we call fractionated skin revitalization. Okay. So fractionated lasers make tiny little microcolumns of injury into the skin. I call them injury because they're really just waking the skin up.
Sort of micro trauma, isn't it?
Absolutely, microtrauma. So this one goes a little bit deeper. So great for scars, for stretch marks, deeper wrinkles, because you can push the water out of the dermal epidermal junction and get just a deeper skin remodeling.
Yeah.
And this one slightly more for superficial crepiness, contours, that sort of thing.
Okay, great. So you can tackle 2 different levels, and both suitable for the face and the body.
You can use that for the body, but I might choose something like Intensive using the EndyMed, which is a radio frequency with needles coming out of that. So I think it's nice now that I have the options to be able to really target skin, face, and body in all of our patients.
I don't even know what this one is. You're going to have to explain. I was trying to guess for a moment.
I know, we should do like charades for aesthetics, right? Everybody who guesses what this is gets a little treat from me.
Evidently, I haven't spent enough time in this room. I need to correct that.
I know, I do love this room. You know, I come from a skin revitalization background, so I'm really in my element up here. So this is something called a Pico laser, again, by my colleagues at Cynosure. This works on a trillionth of a second. I mean, it's the fastest laser on the planet.
My goodness, that's cool.
Absolutely. It works so fast that it can shatter pigment at a trillionth of a second. So you can get superficial, deep pigment, but the speed in which it impacts the skin actually causes what we call a elegant injury. So fast and so powerful that it activates the cell, using a cell signaling to make new collagen, slowly, stealthily, steadily. So I don't know if you can appreciate the honeycomb appearance of the top of that.
Yes, just about. And so what's the reasoning behind that? Why the honeycomb appearance?
So think of a shower head, okay? One laser microbeam is like, you know, when the shower just goes, it's kind of like a boring shower.
Yeah.
And so what you do with the honeycombing, it takes that one hose pipe and it shatters it into lots, like a spray.
Yes.
Spray. And so when it impacts the skin, you're getting a much more widespread area that's covered.
It diffuses it. And what sort of skin conditions are you therefore treating with the Picosure?
Oh, well, we're treating pigmentation, skin revitalization, textural change. So someone that doesn't have that much damage to their skin, but on the opposite end of the spectrum, someone who's a darker skin type, which I can't treat with this. So now I have both forms of laser that can treat up to skin types 4 to 6 and above, which is mine and darker.
Oh, that's amazing. I think, you know, it's so important to be able to treat absolutely every different type of skin color now.
Absolutely. So, you know, that's why it's all about combination treatments. It's all about a great history, clinical assessment. It's very important to be able to then go back downstairs. Just making sure my cameraman doesn't fall on the stairs. You
have a very well-behaved cameraman. He's incredibly well-trained, I must say. I'm going to have to borrow him for something at some point.
And then
thumbs up from the cameraman.
And then the whole part of the treatment journey then finishes again with having your results reassessed. I love to make sure that we're hitting the goal. Want to make sure that we can see that result. So this is where this figure of 8 comes into my practice, Francesca.
It's where the validation occurs, isn't it, for the patient to think, aha, I've been on this journey and this is what I was in pursuit of. I mean, it seems that a lot of the treatments and the protocols that you've been talking to us about are very much about achieving those very sustainable, long-lasting results over time. But I suppose, and maybe the answer lies in your room here, what about for people who are looking for that immediate reset once they can get back to see you for treatment yourself?
Yes, so with the fast and for high impact, high strategy, I go for my injectables. If somebody needs it, if it's the right treatment choice for them. And to be fair with you, the way that these have been constructed and made at the moment are fine hyaluronic acid fillers, and with our great knowledge of anatomy as well. You know, this is my, sorry for anyone who's screaming out there, this is a family item, a gift from my family in America.
Every good doctor has a skull on their shelf.
So I always plan my fillers, actually, come and have a look at this. So this is just one brand of fillers, it's called Juvederm. And as a trainer for them, I've really learned to appreciate and understand how all these fillers behave under the skin. And generally speaking, in the UK, you've got 6 great brands of hyaluronic acid fillers. They're licensed and approved with a great safety profile. And they come in a family, so they have different, what we call viscosities, which means thick densities. And we use them in a layered approach. So take something like Juvederm Volux, because it's much denser and much thicker, I would use it for somewhere like the temple. And I actually start all of my injections in the temple. When you reset the temple and you re-establish a bony scaffold, you actually get a lift of the eyebrow and the eye. When I do this, I actually feel automatically...
I notice such a difference when I have my temples done. And it's interesting because I think it's the one area of the face that all patients would completely bypass, you know, and we all underestimate the effect that just restoring that volume in the temple can have on the overall face.
Yes. So it's, you know, if you felt it, then that's really where we begin. That's what we call the 8-point lift, and it's evolved into something called the 75 MD codes. Next, we use something like Juvederm Voluma. Voluma we use on the top of the cheeks, 3 injection points, and just that, together with your cheekbone injection, you can literally lift the cheek and the eyes to make somebody look much more awake.
And that's what all of us are looking for when it comes to that upper third of our face, you know, forehead down to the eyes. You know, that there's no sort of real augmentation we're looking to do or beautification. It's just about waking us up after this long year.
Absolutely, you're so right. It's about reawakening the eyes again. And, you know, right now at the end of almost 1 year of Zooming, a lot of patients are actually coming in. These are young girls, 28 to 31, and they're saying, I just look so tired and I'm bored of looking at my face all the time. So a combination of one in the temple, 3 on the side, 1 on the top of the cheekbone. That's that beautiful point of beautification, point of projection.
That's where the light hits you and makes you look lovely and fresh.
Absolutely. Illumination. Under the cheekbones, around the eyes. So we use something like this called Juvederm Volbella. And I just want to show you what a hyaluronic acid filler.
I mean, the Volbella is like honey, isn't it? It's very sort of viscous.
I know. So this is something that's also great for what we call the tear trough area, as well as in the lip area, just to gently hydrate and just restore that crisp curve of what we call the vermilion border.
Yeah.
Lips don't need to be overdone, so that's a really nice reset as well, hydration. I want to talk about hydration a little bit more because resetting the skin is about introducing hyaluronic acid. Drink lots of water, everybody. You've got to drink. Don't just depend on the technology and the treatments. But I want to mention 2 fantastic skin booster injections called Juvederm Volite and something called Profhilo.
Oh yeah, both brilliant, and they both do quite different things in my mind. I mean, how would you say that the 2 differ?
Okay, so something like Profhilo I would describe as honey under the skin, okay? It's what we call non-cross-linked, which means that when you actually place it just under the skin in the 5 key injection points, that hyaluronic acid goes in and it just goes. It just absolutely goes under the skin. And it's almost like a light bulb's gone off under the skin. I've treated patients recently and they feel tighter because don't forget, when you stretch the skin, you get a proprioception that also stimulates a little bit of collagen. And because those 5 injection points have been very, very carefully planned by the manufacturers, you do get a lifting effect.
It's very strategic, isn't it? The sort of points, I think it's sort of the top of the cheekbone, it's sort of around the jaw. I can't remember the last time I had it, but yeah, but very carefully mapped out.
Absolutely. And, you know, my colleague Cheryl Marshall-Williams does a lot of this, and every patient that comes down just looks exquisite. Like a light bulb's going underneath the skin. And when I then blend all of my other injectables in and around Cheryl's treatments, the temple, the outer cheek, etc., the patient looks exquisite. They don't look overdone. And I think it's all about just resetting the skeletal template, the facial fat pads, the superficial fat pads, and then finally the skin revitalization. It's almost like restoring. I don't mean to say we all look like houses, but like restoring a home.
Yeah, it's so true. And I love that approach to, you know, resetting our scaffolding, resetting our natural anatomical structure. You know, we're never talking with anything that you do, I don't think, about putting something unnatural or something that shouldn't be there on the face. We're reinstating that sort of natural character.
Absolutely, and let me just take you through a couple of pictures. Actually, this is a very good friend of mine, and you know she's had immediate treatment there, which is why the skin's a little bit red. There's some facial flushing because there's anesthetic within the fillers, so the patient is actually very, very comfortable during the treatment itself. And
yeah, it has lidocaine already in it, doesn't it?
Absolutely. So the whole objective is to look less tired. Same again, less angry, less saggy.
Goodness. But you can see, I think there's something that you've done to the lower face there. There's so much more strength to the profile.
And it's all about the profile. She's a beautiful lady, 53 years old. So we use the Juvederm Voluma in the temple to reset the forehead and the eyes. Juvederm Voluma in the lateral cheek. And you can see that beautiful point of projection. And can you see that light reflects there? She's got absolutely no makeup on.
Yeah, absolutely. Her mid-face is just so energetic now. It's beautiful.
This is what I call a staged approach, Francesca. We generally do this within 2 sessions, and then we finish the lower face with the Juvederm Volite, which is almost like my icing on the cake. You know, this one I say to patients, you might have a little bit of downtime because we need to do about 50 injections on each side. But you can see the difference between the Volbella and the Volite. The Volite is like water.
Yeah, it's very watery, isn't it? And that's really that nice entry level as well for people who maybe are first dipping a toe into the water when it comes to injectables. They know that they want to optimize their skin and sort of get that lovely fresh dewiness, but maybe injectables aren't for them. Gosh, and look at this. What have you done to this lady?
She's had a little sprinkle of absolutely everything, I would say.
Yeah.
So she's had great consultation. We start her off with the IS Clinical, a very tailored regimen that's very close to my heart. And we put her through some high-tech facials, HydraFacial. We did some 3 laser 3 for me sessions using those lasers upstairs. And once we did all that, we did 6 syringes of filler here to get her to this midpoint. And then from here to here was done in 1 sitting with another 5 syringes of filler in exactly the way I've just explained to you.
Yeah, and some people might say 6 syringes plus another 5 syringes sounds like an awful lot, but I think more and more we're having this conversation about, you know, undertreating is underwhelming, isn't it, when it comes to treatment? Yeah. And sometimes to get a very natural, anatomically correct result, you do need to be using more product, but just applying it more holistically to the face.
Absolutely, Francesca. You know, you and I both know that we all have a natural aging profile that is predetermined, but you know that only consists of 35% of our actual aging. The rest of it is very heavily influenced by our lifestyle and environment: stress, sugar, sleep, anything, sugar, even cigarette smoking, alcohol, illness. You know, and that actually precipitates an accelerated way in which we age. And if somebody is accelerating in their aging patterns from their skin, their loss of elasticity, the fat loss because of stress, skeletal aging, 1 or 2 syringes won't touch, one or 2 syringes won't get to the results that they're expecting for, irrespective of age. So you do have to treat the patient and not necessarily the age.
It's true. And also, I think more to the point, you never want to treat an area in isolation, do you? I think, you know, we have to have this global approach so that things don't look out of place or slightly startling or slightly odd. I mean, this is wonderful, and I've absolutely loved seeing this tour all around your clinic. I think it's been a real eye-opener for everyone who's watching as well. I mean, up until the point that we are able to set foot back in this gorgeous place, what are the things that you recommend that we can at least be doing at home just to, you know, mentally and physically put us in the right place as we try and reset for 2021?
Gosh, I think we need to adopt a be kind to ourselves approach first and foremost. I think a lot of us set ourselves very high expectations to deliver, sometimes over deliver, and not because we have to, because we want to.
Yeah.
And we set that demand upon ourselves. I'm going to put myself right up there with that.
I know you certainly do. I mean, it's great for our motivation to set these goals, isn't it? But I think you're right. We also need a bit of a dose of reality as well. What's achievable?
We do. And, you know, I always say, you know, take time to find people who can help you as well. I'm so blessed. I have the best team ever. They're all out there listening. big shout out to you. Thank you for setting up the clinic. It looks awesome. And you know, when you immerse yourself with people who genuinely want to get to the same goal, whether that's your family, your team, your friends, it doesn't matter. Reach out to those people and just be there with them. I think immersing yourself with the right mindset, colleagues and people makes so much difference. It makes such a difference to me.
Yeah,
And sleep,
agreed.
I cannot stress the importance of sleep right now. And I really have to spend a lot more time in that, which is why I've actually got my Celluma and I've actually been taking it home. So I wrap that around my head.
You sleep in your Celluma. Of course you do.
My Celluma, because you know it gives me the opportunity, Francesca, to switch off. But with it switched on, I'm reawakening my mitochondrial cells as I sleep.
Always multitasking, even in your sleep.
I'm going to remember that one, multitasking in my sleep. But this is me to a nutshell. So if I'm going to multitask in my sleep, I better be high performance with my high performance.
I wouldn't expect anything less.
Yes.
Well, that's amazing. And thank you for ending on such a positive note. I think you very neatly circled back around to our starting point, which, you know, as any prospective patients of yours will come to see is obviously the end of their treatment journey, but it's not the end because they carry on this path with you, and it's something that you check in and, you know, you maintain those results with that sort of long-term relationship, don't you? It's a real partnership, so to speak. And it's been wonderful having the guided tour. So thank you so much for joining us, for giving up your evening and for such an immersive experience. Goodness, it's been, time has whisked past.
Time has whisked past. Well, I just hope that this has brought value to your audience, Francesca. It's been an absolute pleasure to be able to invite everybody into my home when the home is actually closed.
It's been, we've got some great feedback on all of it from all of our audience watching today, and yeah, I think it's been great just to be back in the clinic, and yeah, even if we can't be there in person, we'll be there very, very soon.
I look forward to welcoming you back, everybody, and I look forward to also seeing you again, Francesca.
You too, Sharina. And on that note, cheers to the start of 2021. Thank you.
Cheers, Francesca. Happy 2021. Be kind to yourself and be good.
Absolutely. Will do, Sharina. Take care. Thank you again.